Hello everyone. Today, let's discuss certain questions which have appeared in previous exams of NORCET. So this question had appeared in NORCET 2023. So let's see the question. So it states, which option describes orthopnea? So let's see what orthopnea actually means. So as the name suggests, ortho in Greek means straight, or it also means vertical. Straight. Then apnea. Apnea refers to momentary stopping of breathing. Momentary stopping of breathing. So from the word we come to know that there is a stopping of breathing in some position, that is a straight position, which actually is lying down position. So this is what the word means. Let's go through the options. Let's start from the last. So here it says rhythmic waxing and waning of respiration. What does it mean? So waxing and waning means waxing is increase in the number of respiratory movements as well as the depth of movements, and waning means decrease in the number as well as the depth of the respiratory movements. So it just states the pattern of breathing, whereas the position is not mentioned. So this cannot be the answer. Next, let's see the third option. Here it says difficulty in breathing. So as we all know, difficulty in breathing is termed as dyspnea. Even here, the position of the patient or the individual has not been explained. So this also cannot be the answer. Then we have slow breathing. Slow breathing, we call it as bradypnea. So even here, the position of the individual or the patient has not been mentioned. So this also cannot be the answer. Now let's see the first one. It states like this: ability to breathe only in upright, sitting and standing position. So though this is not a direct answer, they have clearly mentioned that the patient is able to breathe in the upright, sitting as well as standing position. So the lying down position has not been mentioned. So this means that patient is unable to breathe when he is lying down, which is supine position, or you can call straight position. So as per the definition, the patient is unable to breathe when he is in a straight position. So this has to be the answer. So orthopnea is a condition where the patient is unable to breathe or has momentary stopping of breathing when he is lying down. So it occurs more commonly in congestive heart failure when there is collection of fluid. When the patient lies down, the heart is unable to pump as a normal individual. So as a result, some fluid gets accumulated in the lungs. Because there is fluid in the lungs, there is less oxygen transfer going on. As a result, the patient feels difficulty in breathing and he wakes up and takes up the standing or upright posture so that the fluid gets drained out from the lungs and the oxygenation improves. As a result, the patient feels better. So there is another concept called PND, which means paroxysmal nocturnal dyspnea. Paroxysmal nocturnal dyspnea. So both are closely related. Whereas paroxysmal nocturnal dyspnea, as the name suggests, nocturnal means night. Dyspnea is difficulty in breathing. And paroxysmal is, it happens unexpectedly. Like it shouldn't have happened in that condition, but still it appears like that. So what is the paroxysm here? So in orthopnea, what happens is the patient has immediate difficulty in breathing when he lies down. But in case of paroxysmal nocturnal dyspnea, the patient gets the symptoms of breathing difficulty after sleeping for 2 to 3 hours. So the patient feels that he is unable to breathe. He goes to the window, takes deep breaths of fresh air, and then he feels better. So it is called paroxysmal because it is not that the patient feels better after inhaling the oxygen. It is because of the position of the patient, but because he wakes up, he is in an upright position and goes to the fresh air, he feels that fresh air has relieved his symptoms, but actually the upright posture has relieved his symptoms. So that is the paroxysm here. Hence it is called as paroxysmal nocturnal dyspnea. So it is a slightly different from orthopnea, though the causative factors for both the conditions are heart failure. PND occurs more commonly in left-sided heart failure, whereas orthopnea occurs in both-sided heart failure, also called congestive heart failure. So this is all about this question. Hope you all got it. Thank you.